We look at those struggling with severe mental illness and the danger they could pose to the public without proper support. This summer, huge failings were exposed in the care of Valdo Calocane, the paranoid schizophrenic man who killed 3 people in Nottingham last year. Well, now, one woman whose son suffers from the same condition told us that she is scared that he could be next. The Health Secretary told us the issues raised in our report give him sleepless nights and that he will now be looking at tightening the supervision of some mental health patients. Our health correspondent Rebecca Barry has this special report.
Dear team, I'm scared when he's like this. I shouldn't have to live in fear. What are you going to do? Wait till he's killed me?
The desperate emails to doctors from the desperate mother of a man with schizophrenia. Last year's deadly attacks in Nottingham exposing failings in mental health care.
Dear doctor, I've woken up to the news this morning about Valdo Calocane. I am so upset because no one's listened to me for years. I am scared my son will hurt or kill me. Don't let him become another Valdo Calocane, because I'm telling you, he's another tragedy waiting to happen.
Like Valdo Calocane, her son refuses to take his medication. She wants mental health services to do more for the safety of him and others.
You ring an ambulance, they tell you to ring the police, and it just goes round and round in a circle, and you just do not get any help. You just can't believe it, that they can leave someone so vulnerable in the community with no care. It's an awful thing to say. I've planned his funeral in my head because I think I'm going to be burying my son before I die. It makes me so sad because he deserves better.
She says he's vulnerable and has also been misusing drugs.
They're seen as a drain on resources. They're too complex. They won't comply. I feel broken. My heart's breaking. And it's wrong. He deserves to be looked after.
The vast majority of people who kill in the UK don't have a mental illness. But the most recent research shows that 11% of people convicted of homicide in the UK were mental health patients, an average of 61 convictions a year. A key factor in those cases is disengagement, or people not receiving the treatment they should. In Leeds, a consultant psychiatrist and a nurse are on their way to see a man with severe mental illness.
We're going to see a gentleman to discuss his community treatment order.
This is an assertive outreach team.
We go to the patient.
They regularly visit patients, making sure they take their medication and get the help they need.
The people who are living with very severe mental illness have a life that is hard for most of us to imagine. They might be very mistrustful or even paranoid about the world around them, hearing voices which kind of steer them away from getting the help that they need.
But only a third of England's local health systems have an assertive outreach team like this.
What we need is services like our service, where we go out to people. We're very determined to avoid bad things happening, because unfortunately there are cases where all of this leads to people becoming very agitated and that turning into tragedy.
Harley was a really lovable boy. He liked to be around his friends and his family. He was my best friend. He was such a lovely kid.
This is the first time Jo has given an interview about the death of her son.
There were multiple doctors, medical professions around him, and then somebody asked what the time was, and that was it. That was when I knew he was gone.
12-year-old Harley was run over outside his school in Essex by a man with schizophrenia. His killer had repeatedly warned police he might do it. A mental health assessment to decide whether he should be detained lasted just 3 minutes.
Obviously, I see Glover as an horrific person that took my son's life, but in essence, he was failed as well. He was very, very ill, and he should have been treated. It's just the same thing we hear over and over again. Lessons will be learned, and in my opinion, nothing is happening. There's no real change.
An inquest found failings by Essex Police and mental health services possibly contributed to Harley's death. Both have apologised and insist improvements have been made.
My ministers will legislate to modernise the Mental Health Act so it is fit for the 21st century.
The government has promised to change mental health laws to give patients more control over their treatment. But the families of those killed in the Nottingham attacks want patient choice to be balanced against public safety.
There have been heinous violent crimes, assaults and murders by individuals with similar situation, background, circumstances to ours, and with families who are as shattered as we are. And it's not a case of if, it's a case of when it happens next.
We hear about it every day, about a knife attack here, a knife attack there, and I now understand the pain they've gone through, and I couldn't wish that upon anyone at all. It's honestly the worst thing ever.
I'm very binary about it. As a doctor myself, killings through mental health conditions are completely avoidable. It is a catastrophic shame that they are not avoided because of simple failures.
NHS England has asked every local health system in England to review how they engage with people with serious mental illness. How confident are you that there won't be future mental health homicides as a result of failings in care?
I'm very confident that services right now across the whole country are looking at their local arrangements. If I said this would never happen again, I doubt you would believe me. What I can say categorically is right now, across the country, people are working really hard to expand and grow their services.
The trust responsible for the care of this woman's son says they do everything they can to support patients within the legal framework. She feels for all the families we've spoken to.
I know what you're going through. I don't want to repeat that. And I'm begging the government to listen.
And she wants to meet you to explain to you the difficulty of navigating the mental health system. Would you consider meeting her?
There are many things that give me sleepless nights about the state of our NHS at the moment, and the supervision of the most ill people in our society, mentally ill people in our society is one of those issues. One of the things that we will be looking to tighten up is the supervision and control of patients in that situation. And of course, I would be more than willing to meet with, and for ministers to meet with, the families.
The government says it will look carefully at its planned reform of mental health laws in light of these families' concerns. Rebecca Barry, ITV News.